Hello.
Hello. All right, Medication Monday. I have a new
Awesome.
medicine.
Glad to be back here. I think all weekend I just think about Medication Monday. I get so excited about it.
Well,
Yes,
good because
indeed.
this is a good one to get excited about.
Okay, all right, great. Let's see what you got.
Wellbutrin.
Wellbutrin. Oh my goodness. Wellbutrin is a fantastic medication because it helps so many people. What do you want to know about Wellbutrin?
Let's see.
All the things.
Lots of people report wonderful side effects, and it seems like a wonder drug. Is it a wonder drug for folks?
It can be for certain, and the reason is that out of all the antidepressants, Wellbutrin mainly works by raising dopamine and norepinephrine. Those are neurotransmitters that help with focusing and with energy. So a lot of times Wellbutrin is helpful for folks who have depression, who just have a sinking mood, and they have low energy, trouble getting up in the morning, trouble focusing. Maybe they're sleeping too much. Those are all problems within depression. So we will add that in. And what's nice about Wellbutrin, if one can tolerate it, it doesn't cause sexual side effects as nearly as much as some of the other antidepressants. And by that, I mean like low libido or trouble having an orgasm. In fact, we might add Wellbutrin to an SSRI like Lexapro or Zoloft or something to offset sexual side effects on it. So we mainly prescribe it for depression. Sometimes we use it for folks who have ADHD who ought not be taking a stimulant, like they've had trouble with it or they had bad side effects on a stimulant like Adderall or Ritalin. Other things about Wellbutrin would be that it can make people jittery sometimes. It's kind of like the caffeine of antidepressants. It can cause insomnia, a tremor, low appetite sometimes. And some people get irritable or angry on it, like it kind of lights them up a bit. It's also one of those antidepressants that above 300 milligrams, it can cause or have a higher rate of causing seizures in people, which you hear about a lot. We tell our patients a lot about it, but in reality, I haven't had many patients ever have a seizure on it. It depends on the patient. So if anyone's listening to this, you should talk to your own doctor about this type of thing. This is not medical advice per se. But when folks hear about the seizure warning, they sometimes worry about it. And the reality, from what I understand it, from the package insert, is that usually at 300 milligrams or 150 milligrams, Wellbutrin causes the same amount of seizures that like maybe Prozac or Lexapro might cause, or other antidepressants. So it's quite a safe medication overall. And it's well tolerated because it doesn't make people tired, and it usually helps them, perform better in life.
So how long can someone usually take Wellbutrin?
I've had patients on it for probably 15 years. So now when you're taking something for 15 years, your brain might get used to it. And then patients often say, well, I don't know what this is doing for me anymore. But it's when they discontinue it that they start to feel bad and they go, oh, this was doing a lot more for me than I thought.
And is this like one of the first drugs doctors will normally try, or is this something that folks get prescribed a little later through their medication?
It could be both. When patients come in with comorbid or co-occurring anxiety and depression, we may use an SSRI like Lexapro because that medication treats both of those syndromes, whereas Wellbutrin targets mainly just depression, or it's FDA approved for depression, not for anxiety, although some people tell me they feel less anxious when taking Wellbutrin. So it depends on what the patient presents with. But you could definitely start Wellbutrin first for somebody who had depression, who you thought it would be a good fit for them. But I have folks who can't tolerate stimulating medications And it's not until much later that we say, hey, let's give Wellbutrin a try alongside Zoloft, and the two pair well together. Yeah.
That's very interesting.
Yeah. So that's good one to discuss, because a lot of folks take Wellbutrin, and it's very commonly prescribed. But always remember to talk to your doctor about these before starting them, and knowing the risks and benefits of them. So,
Excellent. Thank you.
okay, you're welcome. See you next time.
See you next time.
All right.